Okay, good morning, everyone, and welcome back to the UBC Learning Circle. We're thrilled to be here today with the FNHA to finish our two-part series on the Virtual Doctor of the Day program. We apologize for the delayed start this morning, but glad that you're able to join us now. Joining us in circle are Dr. Terry Aldred and Atma Sigobin to share their experiences and perspective as it relates to the program and to kind of continue the conversation we had started way back at the beginning of the month. So before I get into anything else, I would like to acknowledge that I'm zooming in from the traditional and ancestral territories of the Comox First Nation. I would also like to acknowledge the First Nations Health Authority for generously funding the UBC Learning Circle and allowing us to have the chance that we do. So gentle reminder here, the topics we cover can sometimes be sensitive or emotionally triggering. If that's you for today, please make sure that you're looking after yourself. If at any point you feel that you need to talk to a friend, elder, counselor, or a family member, please don't hesitate to do so. Briefly, introductions. My name is Cole. I'm from the Chawatha First Nation. Sharing our digital space today, but off camera is Cynthia, our production coordinator. If you feel so inclined, please introduce yourself in the chat box. We'll get that conversation kind of rolling as I pass the mic on over to Dr. Terry Aldred and Atma to kind of introduce themselves and get us started. Why don't we start? Atma, would you mind starting?
Sure, I was actually going to say ladies first. Dr. Aldred, if you'd like to go first.
Sure, thanks, Em. So Hadi, good morning, everyone. My name is Terry Aldred. I'm Deketh from Clasden, a member of Lasilia the Frog clan on my mom's side, and on my dad's side, I'm Métis Cree and mixed European. And I'm very privileged to call in today from the Lheidli traditional territory, otherwise known as Prince George, and the home of many of my relatives. My trade is I'm a family doctor, and I'm calling in today or joining you today as the medical director for primary care for FNHA. I do my clinical practice with Carrie-Sakani Family Services, serving communities in my traditional territories, as well as one of the docs with the First Nations Doctor of the Day. So thank you, and I'll pass it over to Atma.
Thank you, Terry. So my name is Atma Sigobin. I'd like to acknowledge I am zooming in from the traditional and unceded territory of the Coast Salish people, more specifically the Katzie First Nations here in beautiful Pitt Meadows. My job title is Manager of Benefit Management, which my running joke is obviously a fairly clunky title, but I think in just general terms, I'm the policy manager for the health benefits program. I've been with FNHA since 2017 and really joined to help the transition of our drug benefits plan, which I'll talk a little bit about, and was fortunate enough to also work with our transition to Pacific Blue Cross, which is another topic I'll touch on in the presentation today. So thanks very much for having me. I look forward to having a robust conversation.
Awesome. If we could pull up the PowerPoints in and we'll jump right into it.
Wonderful, thank you. So we already went through the introductions, but we're gonna go through some videos from and promotional materials that were developed for the First Nations Doctor of the Day to kind of show and demonstrate a bit of sense of who we are and what we do. And then I'll briefly go through an overview of the First Nations Virtual Doctor of the Day service and probably touch a bit on our VSUPS program, which is Substance Use and Psychiatry. And a little bit about what we're doing with cultural safety and humility. And then I'll pass it on to Atma to cover some stuff regarding health benefits in this area. And then we'll hopefully leave lots of time for questions at the end. Next slide. Thank you. So some background. So right now we're in dual pandemics still, although some light at the end of the tunnel with COVID. And so back in March of 2020, with many communities going on lockdown, many services being interrupted as people weren't traveling, especially to our remote communities, we heard and seen a very urgent need to bring some sort of medical services into these remote, into our rural remote communities, and really across the province as services were interrupted, I think in every space. And so there was this urgent need, and within a matter of 2 weeks, we managed to stand up a provincial service that covered the different health regions to provide primary care to virtually to all BC First Nations and their family members. And the intent was really to bring the care closer to home so that people didn't, if they were in lockdown or if they lost service or lost access to their regular healthcare providers, that we could step in and assist for urgent or non-urgent matters, as the case may be. And our emphasis from the start was to ensure that our healthcare providers were attentive, could have time to listen, and really were supported to provide a high level of care that was culturally sensitive. And we also wanted to be very inclusive. So we wanted to not put in barriers on who could access. And so that's why we felt it was really important to make sure it was for all BC First Nations and their family members, even if those family members aren't First Nations. And the program does include doctors who are both Indigenous and non-Indigenous, including a large number of grads from the Indigenous Family Medicine program. Next slide. So the other pathway that we stood up, which is on the right side, is the First Nations Virtual Substance Use and Psychiatry pathway. And so that was stood up in August. Certainly as we are seeing more and more now, and I think we will continue to see for the next probably couple years, is that the mental health toll that COVID has caused. And so we really see that there was an urgent need to provide additional services to assist people who are struggling with substance use or who have complex mental health diagnoses that need additional and specialized support in that area. And so that pathway runs 5 days a week. The psychiatry runs from 10 till 3, and the substance use pathway from 9:30 to 5:30. And we use the Zoom platform preferably, but can also do phone visits. And that pathway is supported by our care coordinators who help to do some of the liaisoning and connecting people with local services in addition. In the future, we hope to expand on this program and add traditional wellness workers and elders and knowledge keepers, as well as more traditional counselors and psychologists. For the First Nations Virtual Doctor of the Day program, so we provide a full scope of primary care to the best that we can in a purely virtual setting. And so anything that you normally see your family doctor for, we can usually help and assist with. And so this is self-referrals with patient-facing, meaning that you can find the number and call in and book an appointment. We can also take referrals into the program from support personnel. And this line is open 7 days a week from 8:30 to 4:30. And Zoom or phone appointments are how we connect with people. Next slide. So the purpose of the First Nations Virtual Doctor of the Day program, which is our main topic today, is to really provide care that's closer to home, that's culturally sensitive, and that's timely. So we really wanted to have same day or as close to the same day access as possible. We also found it very important to have our program set up regionally. So we have 4 different pathways that cover the different health regions, including the northern region, the interior region, Vancouver, coastal, and Fraser are connected into one pathway, and then the island. And this this served a couple of purposes. One, the docs that work in the regions are usually familiar with the regions and the area, so they're familiar with like the referral pathways and what services are available. And they're also a little bit more connected to the geography, to the experiences of people living in those areas. And so with and so this was a unique opportunity for us to develop a primary care service that was really led and designed for First Nations. Right now, we're also working with the First Nations primary care initiatives, which are going to be, more traditional clinics in various parts of the province. But this was our first, ability to kind of really lead in this space and to do something that, is truly unprecedented. And we really, I think that the people who access the program, because it is, run by FNHA, we get lots of feedback and people are really invested in the program because they feel like it is for them. And with the work, we work with our key partnerships, connecting with other real-time virtual supports, including more specialist supports, more urgent care, and sometimes even intensive care that is needed, especially for our rural remote patients who may need to be transferred and need some additional support to do that safely. And so we work with partners like the Rural Coordination Center of BC, our regional health authorities, the Ministry of Health, and the PHSA to help kind of coordinate and align all of our efforts. Next slide. And so there have been a couple different videos and testimonials developed from people who have used and accessed services. And so these are just a couple of them. I would say it's one of the most rewarding parts of my job is that we get to see the compliments that come in, almost on a weekly basis about the experiences people have had. And we've had some really great response, like on social media as well. And so I'll just read these quotes. So one of them is, it made me feel really safe, like I was in a safe space or a safe environment in my house. I can share and express what my issues are without judgment. It made me feel really safe. Oh, it's the same quote. And so, so I think that, we're also always striving to improve our services and to add additional complements. We work really closely with our virtual substance use and psychiatry pathway. We also have now a care coordinator working with our program to kind of help with coordinating, connecting. And also part of it is some knowledge translation, as we do have some limitations being a virtual only service. And so trying our best to ensure that we really are connecting people with local resources when they need it, and reconnecting them with their primary care providers or their medical homes, as soon as we can, given some of the limitations of the pandemic. Next slide.
How I first found out about Doctor of the Day was through my mother. I was actually sick and I was in bed and it was probably a 2-month wait to even get a phone call. Talking virtually and online, it seemed to be a lot easier. The Doctor of the Day actually had called the hospital and arranged a lot for me as well. So they were really helpful. They went above and beyond. So it was really, really good. It made me feel really safe also. I felt like I was in a safe environment at my house too, talking about my problems, and can share and express and talk about my stuff without being judged or anything like that as well. And I thought that was really good because I've had that up at the hospital a few times and it's really, really not a fun experience. So because I'm a very active guy and I'm really avid with outdoors and all my hobbies. Like I do outrigger and canoe pulling and stuff like that, and I found that it was really hard for me just waiting for something as simple as like an iron deficiency, and they decided to order more stuff to kind of eliminate what it could be. So I thought that was really helpful. But they really investigated a lot more and asked more questions and how long things were going on, and they seemed to really care for me, and we were chatting for maybe about 45 minutes or so. So it was a good one. Yeah, it was a really, really good experience. The thing I liked best about the service is that it was so easy to use, and it was just fast, quick, and interactive, and I'm getting my results so much faster, and it seems to help out a lot more as well because they communicate with my family doctor too. So it seems like I have a lot more care now as well, with different opinions from 2 doctors too. She reassured me that she was going to be there for me as well too, which I thought was really good. The whole process of it actually kind of just blew my mind with how quick everything has gotten, and I'm just getting blood work, everything that I've needed, and it felt like I've been just dragging along and taking a long time. And yeah, I don't know, it's just a really good service. I would definitely recommend Doctor of the Day to anyone. It's just so much easier, especially if you're having issues with getting in with your family doctor or anything like that. I found that it was really, really easy. They almost did all the work for me. I just had called and they put in almost all the work and effort for me and made it seem so much easier. And it was such an easy process, and it was hard for me to figure out, you know, calling doctors, waiting for 45 minutes just to even get an answer saying you're going to be waiting 2 months to talk. And it was just such a breeze, is all I can say. It was just the fact of not being so frustrated having to call here, call there, trying to get in here or whatever. Like it was easy. It was really good.
And this is Dr. Kelsey Louie, and he is one of our First Nations Virtual Doctor of the Day docs. And he also works for FNHA in the OCMO's office. And yeah, I'm not sure if we want to share this video as well, but it kind of goes through what we mean by Doctor of the Day and a few other key points.
Doctor of the Day basically just means a rotating schedule for a physician who provides coverage for that day. So in this case, a Doctor of the Day will be present or on call or working that day, but it may be provided, the service may be covered by somebody different the following day. The virtual Doctor of the Day service works by the client or community member phoning a 1-800 number and connecting with a medical office assistant. That office assistant will then book an appointment with the physician and the client, either by telephone or over the computer or a laptop or tablet, to be able to connect sort of face-to-face virtually.
Wonderful, thank you. And so in summary, the First Nations Virtual Doctor of the Day is a virtually delivered primary care service that aims to provide culturally sensitive, timely care that can include, workup for new symptoms or diagnoses, referrals, and provide treatments and prescriptions as needed, as well as to follow up on if concerns are ongoing. And as much as possible, we do try to connect people with a primary care provider close to home that can provide in-person services, but we can also provide longitudinal care as needed if there's service interruptions or if we can't find local service connections. And again, it's available through self-referral, so anybody can call, or any BC First Nations person and their family members can call to access our service. And I already covered the regional kind of coverage model. So this program is not an emergency or acute crisis response service. And so if you are having an emergency, we do recommend you go to a place that can, facilitate more urgent treatment. And it's not a replacement for services where successful pathways already exist. And so really we're trying to provide access for those who don't, but we really have an open door policy and trying to ensure we help people with the mind that, every door is the right door. And so, so we try to do that work in a good way. And, I did touch on that there are some limitations with what we can do. But if you're unsure, I think that the easiest way is just to, phone and discuss what your concerns are. And if we aren't able to assist you through the virtual Doctor of the Day program, we can connect you with resources that can. Next slide. And so just to touch on the cultural safety and safe spaces. So we really try to build principles and practices around cultural safety and humility and throughout the work, including these principles are embedded into physician contracts as a mandated part of their practice to work with our service. And we also provide ongoing education around cultural safety and humility. We have elders who come and join our meetings and to provide teaching opportunities and to kind of the idea that cultural safety and humility is a journey. And so really to walk with our physicians who are part of the program, as well as our staff, to help continue to do this work in a good way. And that's, based on, the principles that are important to FNHA is one of their priorities in this area. And so we really want, that part is really vital to the work that we do. And so we do have an evaluation framework where we do collect information and feedback from people who use the services around their experience, including whether or not they felt the care is culturally safe. And those evaluation efforts are also ongoing. And so, as time goes on and we receive feedback, that we can respond in a good way to further enhance our services. And there is a complaints and compliments pathway. You can provide feedback directly, to the MOAs or doctors. There's also a survey that's sent out with the appointment date and time that people can fill out afterwards. And there's also a central complaints and compliments pathway with the quality team at FNHA. And so people can submit complaints or compliments through them, and they'll connect with our services about the feedback, and we'll work through that to develop a good plan to further enhance our services and respond to that feedback in a timely and good way. And so I'm just kind of going through the process. So Dr. Kelsey Louie kind of went through this already in his video, but essentially when you call the number, you speak to an MOA, and the MOA reviews a number of things, gets consent to use a virtual service, and kind of goes through what that consent process means. They also go through a safe space framework, which is essentially just like, how we ensure that we can work virtually in a good way that's mutually respectful and reciprocal. And then once the intake process is done, and this is just for new patients, if you've already accessed the service, then it's a lot quicker, but it's just gathering all the information we need to set up the chart, and so that you kind of understand a bit about the service. And then an email is sent out with a summary of what was discussed, as well as when your appointment date and time. A Zoom link will be sent out with that if you choose to have a Zoom appointment. Like I said, phone appointments can also work as well. And then at the time of your appointment, and for the most part, we really strive to have same day access. As time goes on, we are getting busier and busier, and so there have been sometimes needing to wait, usually a day, but not more than that, for an appointment date and time. And then you connect with the physician or specialist at that time. Next slide. So as the medical director for primary care, my responsibility is with the oversight of the physicians, as well as the other health professionals as part of the team. And so I help to draft like the recruitment and selection criteria, as well as onboarding material, in order to start working in a good way, as well as provide the ongoing mentorship and educational opportunities within the program. And we work closely with our care coordinators and MOAs, and soon we'll also have a virtual office manager to help connect all the leadership together, so that we can all work together to provide a good and comprehensive service. And so our team continues to grow. We have quite a large number of physicians who work with our teams, and a large number or growing number of MOAs that cover both the virtual substance use and psychiatry pathway, also the doctor of the day. And so they do a lot of the scheduling, and they often fielding calls from different patients and community members, and they can connect and liaison with the doctors as needed. And then as well with the care coordinators, we now have 3 care coordinators, which is great. For the longest time, we only had 1 or 2. And so now we have one that covers the VSEPS program, as well as the Doctor of the Day program. And then a third that kind of helps with, some oversight and like writing and looking into things to help enhance our services. So kind of as a connection point. Next slide. I'll pass it over to Emma.
Thanks very much, Terry. So for the next couple slides, I want to spend a few minutes just talking a little bit about the health benefits program. I will acknowledge that the program is quite broad. So what I'm going to be doing is really kind of the tip of the iceberg, and hopefully establish a couple places that you can go to get additional information if you need it related to the benefits. So the first place I'd like to highlight is something we call the PBC member profile. I mentioned at the beginning of the presentation that we did partner with Pacific Blue Cross starting in 2019 for the administration of our dental, vision, and medical supplies and equipment, and some of our drug benefits. A very small percentage of our drug benefits do go through PBC. Leading up to that transition and the partnership with PBC, there was a lot of community engagement that FNHA undertook to make sure that we could incorporate the voice and the desires of community in the new plan that we're building with PBC. The one thing we heard a lot, time and time again, in our 100+ engagement sessions was the need and the desire to have better visibility into the benefit plan. So we're really happy to be able to showcase this particular tool. This would not be new to you if you have kind of a group insurance plan through an employer, but it is relatively new in a public plan or a publicly funded space. So we're kind of the first plan of our scale, and a publicly funded plan at that, to be able to offer a tool like this. So what it does, gives you a bit of insight into your coverages for things like dental, vision, MS&E. It allows you to see what's been billed under you and what coverages you have left, because there are certain items where you do have limits and things like that, or I should say thresholds more specifically. So it's a good way for you to be able to track what's been used and just get some visibility about what's covered under the plan. So a couple key features, like I said, it allows you to look up your dental, vision, and medical supplies and equipment benefits. Our partnership with PBC really allowed us access to a much larger network of providers, especially under the dental benefits. By far and away, most providers are able to just bill FNHA directly for services provided. But in the rare event where a client needs to pay upfront, the app does allow them to submit claims online and actually also set up a direct deposit so that payments can be processed and just deposit directly back into their bank account. We have seen processing times as quick as 2 days between submitting a claim and actually receiving a payment. So it's an awesome tool in the rare occasions where you might need to pay upfront. And then finally, on the PBC membership, PBC member profile, another piece of feedback we received in those engagement sessions, it was quite evenly split, to be honest with you. Some individuals did not want to have to present a status card to be able to access their benefits, and some people did. Some people were quite passionate about having the ability to do that. So with the app, you have the option. If you'd like to, you can print out a PBC card. It's still your status number as your member ID, but it is branded as PBC, or you can present your status card to access benefits as well. So just really happy to put it out there and showcase, again, the member profile, which allows individuals a bit more transparency and a bit more visibility into what's covered by their benefit plan. Next slide, please. Yeah, so as I mentioned, the health benefits program is quite broad. We do cover 6 benefit areas. So dental, obviously anything related to teeth, medical supplies and equipment, so things like canes, bath chairs, mobility devices, wheelchairs, all of that is covered under the medical supplies and equipment plan. Vision benefits, fairly self-explanatory, things like glasses and contacts. Pharmacy or drug benefits, so that includes things like OTCs as well as specific prescription drugs. The medical transportation benefit, which provides access for services that are not provided in an individual's community of residence. So we do support and help subsidize travel costs to get you to a medical center. And then our mental health benefits, which provides access to registered, so FNHA registered psychologists and registered clinical counselors. So unfortunately, for the sake of time, I'm not able to go into a huge amount of detail about each one of the benefit areas, but I did want to touch on a little bit on the medical supplies and equipment, but more specifically on the pharmacy benefits, because those tend to be the items where our Doctor of the Day program touches on more frequently than the other benefit areas. Next slide, please. So I'll dive into the pharmacy benefit, and yeah, I love our tagline here. If you can see the umbrella over on the right-hand side, is that we have you covered when it comes to drug benefits. There's really 3 partnerships that we put in place to provide the coverage that we have under the drug benefit plan. So our biggest partner is BC Pharmacare. It is a provincial plan, so substantially aligned to some of their policies and procedures. We do also have our clients, I should say, also have access to the provincial agencies, and then to Pacific Blue Cross through a bit of what we call a residual formulary. So how that all fits together, we have so kind of back to the umbrella diagram, we have the provincial agencies, which are things like BC Cancer, the Renal Agency, BC Center for Excellence, which our clients now do have the same access as all other British Columbians. We have quote unquote the other pharmacare plans. So there are secondary plans that our clients still have access to. So things like Plan S for smoking cessation and things like that. The primary plan, which is Plan W, W stands for wellness, so Plan Wellness, which we partner with Pharmacare Design, which do have specific accommodations for items that are more prevalent, or more conditions that are more prevalent in First Nations populations. So that Plan W is kind of a work in progress. We're actually working quite closely with Pharmacare on ongoing tweaks to that plan. And then as an aside to Pharmacare, there's a special authority process. So things that are not specifically covered by the plan, but also not specifically excluded by the plan. there's a special authority process that might grant access to some of those items. And then finally, the PBC supplementary formulary. So things that we cannot provide through PharmaCare, we partnered with Pacific Blue Cross to enable those coverages. So things like coverage for Shingrix, for example, we're able to provide that through the partnership with Pacific Blue Cross. I'm going to say it a few more times, but just kind of scratching the tip of the iceberg, so to speak. If you do have any specific or detailed questions about coverage for drug benefits or any of the other benefits I highlighted on the previous slide, please do give us a call. Our toll-free number, 855-550-5454, is staffed from 8 to 4 Monday to Friday, or sorry, 8 to 4:30, I should say, Monday to Friday, by a team of assessors, both at First Nations Health Authority and at Pacific Blue Cross. So you just call the one number, depending on the question and the topic, you'll be routed appropriately. So questions, comments, concerns, please call our number and we'll have an assessor that's able to answer any of your questions. Next slide, please. So what I wanted to do here is just at a really high level, in kind of an ideal world, how you would go about accessing your pharmacy benefits. So step one, of course, see a doctor. They are the primary entry point for pharmacy drug coverage. When you are working with that provider, the provider can usually research within our formulary which items require something called a special authority. So if a special authority is required, the process is initiated by your physician, and they would initiate the process on their end and submit the associated paperwork to PharmaCare for approval. So not something that a client would need to do, but a step that a doctor would complete on your behalf. Once that prescription has been written, in the old days, you kind of walk it over to the pharmacy. I know now there's quite a few physicians that are able to just transfer prescriptions electronically to pharmacies. One thing we always like to highlight for clients as well is when you're at the pharmacy, if you're being asked to pay anything out of pocket, there's usually a problem. So we would ask that either yourself or the pharmacist contact FNHA, and we can usually help with some formulary navigation to find you an item that is fully covered by the plan. Because I didn't touch on it in any great detail, but the plan through PharmaCare is a fully covered plan. So we would cover 100% of the costs for the items that are included. So if you're being asked to pay anything out of pocket, please give us a call. That's an indication that something's not working properly, and we can help navigate that space. And then step 4, assuming 1 through 3 has gone smoothly, the pharmacist will be able to dispense your medication and fully bill Plan W or PBC directly without having to involve our clients to pay anything out of pocket. Next slide, please. So one thing we want to also highlight here is, PharmaCare is obviously well known for the drug component. But in reality, PharmaCare does offer drugs and other services as well. So drug benefits and other services as well. One of the services that we were really passionate about highlighting is Pharmaceutical Reviews. So we have partnered with UBC's pharmacy clinic to set up virtual pharmacy reviews. And the goal is really to audit and review the medications that an individual is taking to ensure that the medications are working together appropriately, and to optimize dosages and to look for any outdated medications or treatments that an individual might be taking. So optimizing your drug treatments as best as possible. That service is fully covered, so there wouldn't be any cost to a client. And if that's something that you'd like to have, you can just contact us at that same 855 number, and we'd be able to get you set up with an appointment. And also just wanted to highlight that a referral is also available through the First Nations Doctor of the Day program as well. So there's a pathway there. And last slide, please. And yeah, so here I just wanted to highlight that there's definitely a partnership and some information sharing between the First Nations Doctor of the Day and the Health Benefits Program. For obvious reasons, we are separate teams, but we are all under the umbrella of FNHA. So we want to keep our physicians abreast and aware of any changes that are happening to our benefit program so that they're well informed and can provide the appropriate supports for clients under our existing plan. So I will leave it there. Back to you, Dr. Aldred.
Thanks, Atma. And I think that concludes our formal presentation, so we can open it up for Q&A.
Awesome. Thank you both very much. I really appreciate you walking us through the program. We do have a couple of questions, so I'll try and kind of get through them as quickly as we can here, making sure that we try and get to all of them today. So the first question that I'm going to ask, or rather just kind of run by you guys, because we had it a few different times actually, is talking a little bit about exactly who could access the program, both from a virtual benefit side and from the virtual doctor of the day. It's my understanding that the services are available for status First Nations individuals. Is that correct, or would you like to possibly elaborate further on that?
Yeah, sure. And definitely it's something I could have chose my words better. It's just kind of, I think I have my script down with these presentations, and it's hard to change it. So that was a question. So it's not just for status First Nations. And, I think initially the thought was for status and non-status First Nations, but we've actually, included like essentially all Indigenous people, so kind of the umbrella. So all urban and away from home people, so status people from other provinces or non-status people from other provinces, Inuit. Essentially, if you identify as being an Indigenous person from Canada, then you can have access to services. And so we are working our urban and away from home portfolio under Wayne Wallace. He's been working with the friendship centers as well as the Métis Association to kind of go through that and ensure that our services are, also culturally sensitive to people who don't identify as First Nations but may identify as Métis or Inuit, and kind of making sure that that process, makes them feel welcome as well. So we really wanted it to be a low barrier, and that we weren't, gatekeeping too much. So I should have said it's for all Indigenous people and their family members in BC.
So if I can jump in, I just want to create a little bit of a distinction between the Doctor of the Day program and the Health Benefits program. Don't want to be the bearer of bad news, but unfortunately the health benefits program is specifically for status First Nations individuals. There are coverages as well for children who are under the age of 24 months, as long as one of their parents is a status First Nations as well. For individuals, especially younger individuals that fall outside of that, sometimes we're able to provide coverage through an exception process or through Jordan's principles specifically.
Awesome. Yeah, thanks for that clarification, Emma. I know sometimes it can get a little bit, having the two of you guys join us in one webinar, sometimes it could be a little bit confusing, but thanks, Dr. Aldred, for clearing that piece up for us as well. That the virtual Doctor of the Day service is open for all Indigenous people, but the healthcare benefits is specific to status First Nations. So thanks very much, guys. So moving forward or through to our next question, is about hours, I guess. And one of the questions we had come in was, is this service available 24 hours a day? The question was specific for the virtual Doctor of the Day service. So could you maybe elaborate a little bit more, Dr. Aldred, on exactly when kind of doctors are available to take calls?
Yeah, so the service runs from 8:30 to 4:30, 7 days a week, 365 days a year, including weekends and statutory holidays, but we don't provide after hours support at this time. So that's why we say we're not like an emergency or an urgent pathway. Really, it's for things that you would normally access your family doctor or primary care clinic for.
Awesome. Great. Yeah, I think that's an important distinction to make here, that from my understanding, Dr. Aldred, the virtual Doctor of the Day service is not looking to supplant or replace current care models. It's more of to supplement and to fill in where needed. So of course, please continue to access other kind of care modalities if you can. So we had another question came in, and it was pretty interesting. It was talking a little bit about kind of follow-up appointments and complex issues for individuals that can't have ready access to clinic. Specifically, the question was talking about people with such complex needs that that phone calls might not work, or the kind of the process of getting follow-ups and stuff with individual doctors. As we spoke about a lot here today, what's important in developing a healthy relationship and in maintaining a culturally safe space is that you know, the individuals can build rapport and feel comfortable and safe with the physician. So Dr. Aldred, I was wondering if, in response to the question, could you maybe elaborate a little bit more on kind of what the process can look like after that initial phone call? What does that follow-up sort of process look like? Is there a capacity to meet with the same physician again? And what would be your recommendations for individuals that feel like they have, or that what they're trying to chat about is very complex and might need to, or they feel like they would like to have a physician kind of in person, or you know, to meet over Zoom or what have you?
Yeah, so great question. So for our virtual substance use and psychiatry pathways, it's generally much easier to meet with the same provider because we have somewhat set schedules, meaning that, you know, we have doctors who work Monday and Wednesday on those services, and then another one who works Tuesday. So it's kind of it provides a little bit more ease around that. And because they are specialist services, and obviously, you know, they go through a lot of information, a lot of sensitive information, you know, obviously building that continuity is good over time. With the doctor of the day service, it just kind of depends. Like, for instance, for me, because I hold a number of different roles, I generally only offer some weekend coverage when I can, about once a month. And so it's really hard for me to kind of carry a patient load per se, or to try to follow up with people in a timely manner on the service. And so I try to be, you know, upfront with that and try to hand off to some of the other doctors who work more frequently. In going forward, especially with Doctor of the Day, we are going to try to, you know, balance the scheduling so that we have some providers who may work regularly, where others are kind of filling in as needed to kind of provide a bit of that balance and continuity. The other thing is that again, I feel like I'm talking a lot about the urban and away from home department. Again, that's under Wayne Wallace. I hope I can mention him. Leadership within FNHA, which is really great and inspiring to kind of see that outreach. And so he is actually working with Spark BC, who donated a number of phones and tablets. And they're working through, I think, the Native Friendship Centers in different areas to distribute those. So, and those phones and tablets actually come pre-populated with the apps and Zoom and all of that to connect and use our services. Certainly, it's still not ideal, and I know connectivity and access can still be a challenge. And so, you know, part of what we're trying to hope to build, especially with our care coordinator team, is to really, you know, be working with clients to kind of you know, if our service isn't the right service or isn't working, it's, you know, even more important that that we find local services or services that can work. And in the meantime, do our best to provide, you know, service to bridge patients so that they're not left in a lurch. And certainly, you know, when, as I mentioned, like, there are limitations, and, you know, it's kind of, we've debated whether or not creating a laundry list of different things we could and couldn't cover. But really, we just felt like it's probably better to have that kind of conversation to kind of work through things with people, and to be able to provide that warm handover, because it is complex, and, you know, sometimes it works in one setting but doesn't work in another setting. And so with providing some of that, we can hopefully help at least take some, because I know like navigating the systems and who does what can be really, really confusing and tricky. And so, we still want to provide like an open door policy. And that may include at the end of the day, it's like, oh, well, virtual psychiatry is probably not the best solution. But, we'll connect you with maybe some other services that would better or more fit your need, for example. And so, so I hope that helps answer your question, but you're right. It's not like a catch-all, and it doesn't, and it definitely still leaves gaps. And the last thing I will leave off with is that we hope in the future, as we're developing the virtual services, that we do connect those to in-person clinics that work with FNHA or want to partner with us, so that we can kind of mirror or add in-person care when needed, and also pair that with virtual care when that's appropriate.
Awesome, great. Thank you, Dr. Aldred. That's a very thorough answer. I appreciate it. It is very complex, but I think I can confidently say for everybody that we're very grateful for the service that is available, and the Virtual Doctor of the Day program is really important. So I appreciate you taking the time to answer, and I hope that answers the question that was asked. So Atma, I'm actually going to pivot to you. We have time for probably about one more question, and then we're gonna go into outros. And this one's around vaccines. If an Indigenous person does not qualify for the HPV vaccine under publicly funded benefit plans, are there exceptions to these limitations that PBC can actually provide at no cost? Like in the case of the Shingrix vaccine was the question.
Right. Thanks for the question. So one thing I would kind of speak to in terms of a plan design for the health benefits program, one thing that we're really mindful of is trying not to duplicate services. So ideally what we'd want is one intake or contact point for a particular service. It just makes navigation of what's already a complicated space, hopefully a little bit easier. But we also heard quite a bit in those engagement sessions that I mentioned before, a desire to get rid of what was referred to, so not my term, what was being referred to as the Indian line. So again, being really mindful that we wanted to integrate it into provincial systems, not create duplications of services. So the one thing I would highlight with the Shingrix vaccine is that it's not available through any publicly funded avenues. Given the impacts that it can have, especially on elders, FNHA felt it very important to provide that coverage for clients. Contrasts a little bit to the HPV vaccine, where in some cases it is available through a publicly funded source. So in those cases, FNHA would not provide coverage for something like that. So short answer to that question, unfortunately, is no. We wouldn't cover the HPV vaccine because it is available through a publicly funded source. That being said, the formulary under FNHA is under a constant review. So the door is not closed as in forever. So at some point in the future, that may change. But currently, unfortunately, it's not covered by the plan.
Thank you, Atma. I appreciate it. Okay, so I'm being very mindful of time, and I apologize that we started a little bit late here today, but it is 10:57. So I think at this point we'll probably start our outros. On behalf of the Learning Circle, Atma, Dr. Aldred, thank you so much for joining us today. I really appreciate always to chat with you and to get your perspectives and experience kind of shared within the circle. Thank you both very much for making some time in your schedule today. And to everybody else that joined us, thanks very much. I know it's probably a busy Wednesday before before a longer weekend or before a holiday. So I really appreciate everybody joining us here today. If you have any further questions, again, the PowerPoint will be posted, and there was a link or sorry, an email and a phone number and stuff like that for both programs. This is a quick update on our website. If you'd like to check us out, be sure to follow the. Be sure to check out our website. This is our last session of the season, as it were. So we will not be having any more learning circles, sadly, in July and August. But please stay tuned at the website to check out sessions that are coming up in the fall. We have some really exciting plans and collaborations with the FNHA and with other partners, as well as producing our own content. If you have any topic in particular that you would like to see in upcoming learning circles, particularly in the fall and in the winter, please don't hesitate to shoot us an email. Check out the website again, posted here. Yeah, we look forward to hearing from you. But until next, yeah, thank you from us. Thanks, Sin, very much. This will be our last session for the season. So thank you both, or thank you all very much for attending. Appreciate it. Until next time, take care, guys.
Thanks for having us. Take care. Bye, everyone.